Hi, I'm Dr. John Heary, and today we're going to be talking about a topic that is near and dear to my heart. We're going to talk about HIIT training, high intensity interval training, and how it relates to blood pressure. So, when it comes to lowering blood pressure, exercise is a non-negotiable factor. Are you maybe thinking, what is the most effective form of exercise to lower your blood pressure? Well, there's more and more research studies out there that are showing exciting results of something called HIIT training in lowering blood pressure. And again, so HIIT stands for high intensity interval training. All right, so what is HIIT? HIIT is not any specific exercise, rather it's a technique. So you can apply this technique to almost any kind of exercise, whether it's walking, riding a bike, swimming, doing body weight exercises, or even dancing in your living room. One thing you always want to do is make sure that you check with your physician before starting any form of exercise program for high blood pressure. Now, HIT HIT training consists of combining very short bursts of working at your absolute max, alternating with short periods of active recovery rest. Research has found that this form of exercising gives you more health benefits than any other type of exercising, and it also shortens the amount of time that you're going to need to spend on exercise, and it's more effective. I mean, you can literally just work out for 10 to 30 minutes and you can, reap, great health benefits from doing that. You're going to burn a ton of body fat. Your metabolism is going to be stimulated for long afterwards, after you're done, or after you finish your exercising. And it's also going to help you utilize oxygen more efficiently. And one of the biggest benefits that people, find from HIIT training is the reduction of their training time. So through HIIT, you can put in about half the amount of time compared to traditional cardio exercise to reach your goals. There's one study that found that literally, and this kind of blew my mind, but literally just 2 minutes of HIIT sprinting increased metabolism as much as 30 minutes of running. HIIT, HIIT increases the efficiency of your heart, and HIIT also has a major effect on naturally lowering your blood pressure. So, although most any type of exercise, it's going to have its benefits. HIIT it shines. It's very impressive when it comes to saving time. It's literally it's the ultimate shortcut when it comes to exercise. And study after study shows that HIIT exercise improves blood pressure in people with hypertension better than any other kind of exercise routine. And it's extremely effective in reducing your resting heart rate and blood pressure in overweight and also in obese individuals. It's been shown that HIIT exercising just 3 times a week for about 20 minutes at a time lowers blood pressure more effectively than continuous endurance training. So let's let's talk a little bit about the science behind HIIT training. What makes HIIT training so effective? So HIIT training changes something called endothelial function. All right. So the endothelium is a very thin membrane that lines the inside of your heart and also your blood vessels. So the cells in this membrane release a variety of substances that control how your blood vessels relax and also contract. And we know that stiff, hard arteries play a role in high blood pressure. The the ability of your artery walls to expand, or what's called vasodilation, is very important. You need to have flexibility in your arteries to allow appropriate blood flow throughout the body. So now, how does HIIT come into play? HIIT improves endothelial function and it reduces the stiffness in your arteries more so than any other traditional form of exercise. And just a 1% improvement in your endothelial function can result in a 13% reduction in the risk of cardiovascular events like heart attacks and strokes. One study showed that that 73% of people restored blood pressure back to normal using a HIIT training method for just 2 months in 24 exercise sessions. There is a significant reduction in the systolic blood pressure, which is the top number in the blood pressure. and it was around 145 plus or nine beats to 118 plus or minus 15 millimeters mercury. So let's talk a little bit about how you can apply HIIT training to your routine. So when you're going all out at a high intensity for short amounts of time, you then what you want to do is you want to have active recovery rest for a short interval. So you can apply this technique to any kind of exercise, whether it's walking, running, jumping rope. You can do it to cycling. You can do it to weight training. Um, Let me give you an example of how to use HIIT utilizing a stationary bike. So you want to warm up for about 5 minutes on a lower setting, and after your 5 minute warm up, you're going to increase the tension on the bike, and then you're going to pedal as fast as you can for 20 seconds. This is called the sprint phase. After you're done with that 20-second sprint phase, lower the tension on the bike and comfortably pedal for 2 minutes. And once you get done with that, that's going to be your first round of HIIT. You're going to repeat the above 5 times, and then you're done. I want to give you a tip on heart rate recovery. So after doing your 20-second sprint, lower the tension and wait 60 seconds and check your pulse. You want your elevated pulse to come down between 8 to 10 beats, and that's going to be your heart rate recovery zone. If for some reason that your pulse doesn't come down 8 to 10 beats, you should stop and call it a day. So for example, after you do your all-out sprint for 20 seconds, your heart rate goes up to 110 beats, all right, per minute. After a minute of decreasing the tension and comfortably pedaling, your heart rate should come down to around 100, 102 beats per minute. That's a good heart rate recovery. Now, although I mentioned above, stationary bike is, it's a great form of doing HIIT training. You can apply it to walking as well. So, simply, walking at a comfortable pace for 5 minutes, to warm up. Then you're going to do an all-out brisk walk for 20 seconds, and then you're going to walk comfortably for 2 minutes, and you're going to repeat that, 5 times. And that's all you need to do to maximize HIIT training and to lower your blood pressure. Give it a shot. Let me know how it goes. Again, it was great talking to you guys today, and I'll talk to you guys soon. All right, take care. Bye, guys.